quote, even though they're patients, they're also inmates, end quote, explained Dr. Patricia Timinglow, a clinical psychologist at the Guam Behavioral Health and Wellness Center. During a status teleconference this morning with the Department of Justice on the line, Timinglow, along with GBHWC psychiatrist Dr. Victor Perez, took to the stand to describe how the agency has handled what they have observed to be an increase in referrals from the Department of Corrections in the last few months. According to Dr. Timinglow, she's observed 4 or more prisoners at the GBHWC daily. During her testimony, she noted that there's no segregation when prisoners come in need of mental health care. That means prisoners as well as the corrections officers are left in the lobby, what she called, quote, a big risk factor, end quote, as commingling with other consumers becomes an issue. She also noted that the agency is not ideal for servicing prisoners because the agency lacks a forensic unit, doesn't do lockdowns, and lacks other forms of restraints. Nonetheless, as the only public facility on island, Dr. Perez testified that, quote, anybody who walks in that door has access to service, end quote. Ultimately, both mental health specialists agreed that DOC would benefit by having an on-site specialist, which they did until 3 months ago. Present at today's status hearing was clinical psychologist Dr. Andrea Lighthouser. For the last 4 years, she catered to DEPCOR's mental health needs, but when her contract expired in February, she did not have her contract renewed. Although U.S. Assistant Attorney Michael Schwab, as well as Dr. Lighthouser's attorney, Patrick Seville, requested that she take the stand to testify, their request was opposed by Assistant Attorney General Donna Lawrence, who called the potential testimony, quote, self-serving. The court sustained the motion, noting that already DEPCOR's medical director, Dr. Raja Saad, testified earlier this week. As we reported on Wednesday, Dr. Saad admitted that since Dr. Lighthouser left DOC, he's been forced to refer any mental health-related issues directly to GBHWC. This has resulted in the influx of prisoners at the Tamuning facility over the last few months. Last to take the stand today was Department of Public Health and Social Services TB Program Manager Cecilia Arciaga. Although Dr. Saad said there was a TB crisis at the prison earlier this week, Arciaga says this is up for debate as it depends how you define crisis. Since day one, Arciaga assures the court that public health has worked diligently with DEPCOR to conduct testings as well as treat the individual with the confirmed case of active TB. As of today, she says the pretrial detainee is no longer contagious. As part of a PowerPoint presentation she made to the court, it became clear that TB is overall more prevalent in Guam than in other places, highlighting that Guam has 3.6 times more cases than Hawaii and 10 times more than the United States. More testimony and closing arguments on the matter will be heard on Monday, June 2nd at 8:30 a.m. Reporting for Guam's News Network, I'm Crystal Paco.